Before, during, and after menopause. It spans our entire life, right? There are so many questions about pre-menopause, perimenopause, when this transition occurs, how can I start taking steps now to have a healthy menopause journey and a healthy rest of my life, as well as what is menopause, when is that, how do I know it's coming, and what do I do after menopause, that post-menopause journey, which is the rest of our life. Now, that is the second spring of our life. So in this podcast, I'm going to answer many of the common questions about pre and perimenopause in part one and menopause and postmenopause in part two. So wherever you're on your journey, this episode's for you. So to help ask the questions that are commonly sent in and that women have about their journey, I have my daughter Amira joining me again on the show. Welcome, Amira.
Hi. I'm so happy to be here today.
She will be the voice in the background asking these questions. And so here we go.
Okay, Dr. Anna. So, first to start our pre and perimenopause journey, our first question is when does perimenopause typically start and how long does it last?
So it can really depend on your overall health and your genetics and or epigenetics as far as when perimenopause starts. It's typically 10 to 15 years before menopause, and many women start experiencing symptoms in their mid 30s as progesterone starts to decline in our mid 30s. So we tend to see that. We used to say, according to our OBGYN and reproductive endocrinology textbook, the gold standard by Dr. Spiroff would say, oh, 2 to 5 years. Really, it's a 10 to 15, it can be a 10 to 15 year transition. I would say that is true in my life and many of my patients' lives.
Thank you, Dr. Anna. Now, how can I tell if I'm entering perimenopause? What are the early signs?
So sometimes you'll start experiencing PMS symptoms such as mood swings a week or two before your period or a few days before your period starts. You may notice some difficulty sleeping through the night, decrease in energy, start to gain weight, some breast tenderness. Anxiety symptoms are very common during this time too. So that just means we need to optimize your hormones, but those are some of the perimenopause common symptoms. Also, then there are hot flashes, and you can experience aches and pains in your joints, frozen shoulder, say the 40-year-old shoulder. I really hate that statement. Having had frozen shoulder myself, completely resolved, y'all. It is completely resolvable. And heart palpitations. So those are some other experiences. They're really associated anywhere between 50 to 80 symptoms in the perimenopause. But again, while menopause is natural and mandatory, suffering is optional.
Absolutely. So, is it normal to have irregular periods during perimenopause? What patterns should people expect?
It is normal to have irregular periods in the perimenopause journey, where menopause is defined as 12 months after your last period. But that time to have that just complete cessation of periods for women who have regular periods and all of a sudden no more periods, that is the exception and not the norm. Oftentimes, it can be irregular, spaced out, or more frequent cycles. You may experience ovarian cyst symptoms. You can experience bleeding dysfunction, heavier than normal periods, can also be experience more cramping. But again, these are things that from a functional and hormone optimization approach, we can optimize. We can get rid of these symptoms. But that irregularity is quite common and nothing to be distressed over, nothing to take a birth control pill for.
Mm-hmm. Absolutely. So, also, question, why am I gaining weight even though my diet and lifestyle has not changed?
Oh my goodness. Okay, that weight gain without doing anything different. Now, that's what I experienced way back in 2014 when I had the full-blown perimenopause symptoms. So that's what that was a long time ago. That was over a decade ago. But it led me on this journey to help solve the problem for myself and for so many of you. So that weight gain without doing anything different. So part of my story is that I was well over 240 pounds at one point, And I lost that weight, about 80 pounds. And then I kept that off for quite a number of years. And all of a sudden, I hit age 47, 48, and I started gaining weight without doing anything different. And it was like 20 pounds overnight, it felt like. And so that's what really drove me into the research and creating my keto-green method. I write about this journey in my book, The Hormone Fix. And this is what I teach about in my programs. But it's understanding that it takes more than hormones to fix our hormones. And it's the
Mhm.
underlying addressing the lifestyle changes and addressing some of the major hormones to balance our reproductive hormones and our metabolic hormones to really treat some of the metabolic dysfunction that can happen during that time.
Yeah. Can individuals who are also who they know they are in perimenopause, can they still get pregnant?
So, yes, the answer is yes. It is possible in perimenopause to conceive. Timing becomes difficult if you're doing natural conception, but really knowing your body, it's critically important to understand the signs and symptoms of ovulation, the period of fertility. But because in perimenopause, the cycles really can be irregular and ovulation can be, you know, 20 days, 12 days, 30 days. I mean, it can be very difficult to use natural family planning during that time. So have a backup method. So condoms, IUD, those are some of my
Hmm.
favorites if you're trying not to get pregnant. When I say IUD, I mean the non-hormonal IUD. Yeah.
Yeah, the copper IUD, but you always want to make sure you're intaking more iron when you're on the copper IUD, so you're not.
And zinc.
Yeah, iron and zinc. Um, right, it's iron or is it mainly zinc?
Zinc, but also if you're bleeding heavier with a
Yeah.
copper IUD, you
Hmm.
want to make sure you've got enough iron in your diet. You check your ferritin level, total iron binding capacity, and make sure that's optimal too.
Absolutely. Thank you, Dr. Anna. Also, why am I experiencing mood swings and anxiety when this never used to be an issue?
Okay, so this is something I'm really passionate about women understanding, because oftentimes you can feel bipolar in perimenopause until you get this right to balance our hormones and our neurotransmitters. It's a process, but you can get this right. The feelings of anxiety in perimenopause is because progesterone levels are starting, is one of the reasons is all progesterone levels are starting to decrease, whether it's from natural ovarian aging or it's from cortisol depleting your progesterone or it's a nutrition deficiency or micronutrient deficiency. There are several reasons here because our brain, one of the great anti-anxiety nutrients is magnesium. Magnesium is supported is functions in over 300 processes in our body. But as progesterone levels start to decline, we need progesterone to maintain healthy levels of tryptophan. And as estrogen starts to decline, estrogen is related to serotonin production and use in our body. And serotonin, if we're starting to drop levels of the neurotransmitter serotonin, that can cause anxiety. And that can be cyclic. That's hence the PMS symptoms, many of the
Hmm.
PMS symptoms in perimenopause.
Yeah, I feel like even during my own PMS symptoms, when we're all together on our cycle, it can be quite a roller coaster. All
So that's
right.
when you need to take your vitamins that
I
I give
know. We
you
all have to do shots
and your
together and
mighty
take our
maca shots, right? And superfood,
absolutely.
our super smoothies. Yeah.
Hmm. I know we have our own little system here. Okay, so next question related to sleep. So what's causing these new sleep problems, Dr. Anna? I used to sleep just fine.
So great question. Again, as serotonin levels start to decline, from serotonin, we make melatonin. And melatonin is our a natural sedative for us. It's our natural sleep hormone. It's triggered by sunset in the evenings. So a compounding effect. I give a whole sleep module in my course, Magic Menopause, because this is such an important issue. But progesterone is also needed for sleep. And again, if we go higher up, we want to support our adrenal glands to make more progesterone. But as
Hmm.
progesterone starts to decline, we can have difficulty sleeping.
Yeah, absolutely. So are hot flashes normal in perimenopause or only in menopause? I know you were saying that that's one of the 56 symptoms that you may experience when you're approaching perimenopause.
Yeah, you can experience, while they're normal, they're not necessary. Okay. So hot flashes are a symptom. The body's telling you that there's an imbalance going on. And hot flashes in perimenopause as well as postmenopause. I've met women who had suffered with hot flashes for 10 to 15 years postmenopause, but were able to completely resolve them within a few weeks following my method.
Yeah, that's amazing. We've seen some amazing results. Let's see. All right. Hot topic. Away from hot flashes. Why has my sex drive changed and what can I do about it?
So, again, in perimenopause, the loss of libido, loss of sex drive, there are many factors related to that. So it's always reigniting our body's natural hormone capacity. I say this is part of my hormone restoration process, hormone restoration method. So supporting our adrenal glands, we want to do that. With Mighty Maca is an excellent, I would say, aphrodisiac. Helps with and add in zinc. We need zinc to produce testosterone. Is there other causes that are interfering with testosterone, such as birth control pills, stress, statin medication? So there's a trigger there. We do not have to suffer with low libido. Again, I've worked with women in their 70s who have a reignited spark to their intimacy. So it's definitely possible at any age. And when we don't have loss of libido, if we're not in optimal health and optimal energy, naturally, if we're exhausted, why would we want to have sex?
Yeah, exactly. Right. Um, okay, next question. Should I start hormone therapy during perimenopause?
So we know that, this is start hormone therapy during perimenopause. And this is really important factor. First, the perimenopause, the window before we know that starting bioidentical hormone supplementation in this perimenopause time period around the time of menopause is beneficial for the brain, the bones, the cardiovascular system, and just our overall relationships, that's for sure. But before we start hormones, we want to make sure our body's detoxifying really, really well. We're having all the factors that work in to help our body support healthy hormone detox before we add more hormones onto our system or while we're doing so.
Absolutely. Okay, what lifestyle changes should I make during perimenopause?
Oh, so the lifestyle changes I really emphasize making are part of my keto-green method. It really starts with an attitude of gratitude and positivity and mindset. We cannot separate the mind from the body. The second piece is always part of, again, the nutrition and lifestyle plan that I put together.
Mhm.
And that is creating insulin sensitivity as well as stress management as part of this. In my books and in my programs, I created medicinal menus. I always reflect back on the ancient physicians to the kings were their chefs prepared their food, medicinal menus. Food is medicine. And
Mhm.
so sometimes it's adding certain nutrients and dietary, making dietary changes as well as eliminating things that are toxic to our body as well.
Yeah, your famous quote takes more than hormones to fix your hormones.
That's true.
Absolutely. Those are some great preventative methods. Final question in our pre and perimenopause questions that were submitted. Why am I having brain fog and memory issues
Ah,
during this stage?
so when we have brain fog and memory issues, think inflammation and hormone imbalance. So inflammation and
Mhm.
hormone imbalance, and add in adrenal dysfunction, and you've got like a three-pronged problem. I saw the devil's pitchfork. And we address any of these symptoms as the reason for any of these symptoms are one or all of these three areas: inflammation, hormone imbalance, and adrenal dysregulation. So we work to support our body in this process of balancing our hormones, naturally decreasing inflammation. Maybe we need to add back some DHEA and progesterone and estrogen during this time, but we still always want to get to the root cause.
Thank you so much, Dr. Anna, for answering all those amazing questions that were submitted. I know we have answered your questions before, but no matter what, these are so important to get the amazing guidance from Dr. Anna Cabeca. Now we are going to enter.
Well, I also want to say that if you're in pre or perimenopause and you have additional questions, don't hesitate to email our team at drannakabeca.com, team, T-E-A-M, at drannakabeca.com. We were having you email Amira. It is much better to email team at drannakabeca.com. Mail your questions in, and we will be sure to address them. And now we're going to be moving on to the discussion of menopause, definition of menopause, and then what do we do after? What do we do after menopause?
Absolutely. But we do on any of these Q&A calls, instead of emailing me, we have attached a Google form that you can submit all your questions and let us know if you would like us to say your name, if you would like to remain anonymous. And that's a great resource as well. So these questions have been submitted throughout our programs, throughout our communities and our customer service team. So the main question to enter through menopause and postmenopause, how do you know when you have officially entered menopause?
And
Like what?
this can be challenging because menopause, especially early menopause, I mean, certain aspects of an earlier menopause can be reversed. In my case, I was diagnosed with early menopause at 39 and infertility reversed that. Then at age 46, 45, 46, I was experiencing all those 44 to 46 perimenopausal symptoms. And then, dysfunctional bleeding, all the symptoms that I talked about earlier. My period had stopped and then it started back up, and then monthly regular cycles. And then in, age 54 to age 55, I had a couple cycles, and then officially postmenopausal at age 56. And this is something clients who have been in my programs, and specifically Magic Menopause or following my keto-green method, they'll say, okay, my periods had stopped or they were very irregular and now they're back like clockwork. And that is a good thing. Now, there's a certain point in your 50s where that may stop, but I definitely have clients in their mid to late, 55 to 58 still having regular cycles. So we want to support our ovarian function as long as possible. But if you're like less than age 52 or 54 and your periods you've gone more than 12 months without a cycle, we want to try to resuscitate. And if not, if you're 12 months without a period, you're officially menopausal.
Mm-hmm. We love those like period tracking apps so you can really see when the first day or the last day and then go from there as well.
Yep, first day of your last period.
Mm-hmm. Exactly. So going back into hot topic, what can I do about persistent hot flashes?
Yeah, so persistent hot flashes, what scientific studies have shown, and that persistent hot flashes are associated with cardiovascular disease, with a 2 to 3 times increased risk of cardiovascular events. So if you're having persistent hot flashes, this is not something just to suffer through because it's menopause. We want a full cardiac workup. We want to address inflammation, hormone imbalance, and adrenal dysfunction. So that is key. Persistent hot flashes, what I found is as women go through follow my keto-green method, so with intermittent fasting, the medicinal menus, really focus on that alkaline urine pH. If you're new to me, this is something I've been talking about for over a decade now. And so when you focus on this, the hot flashes go away because we're creating a low inflammatory, we're reducing inflammation, but also very importantly, creating insulin sensitivity. So the reason persistent hot flashes, at least one of the reasons that persistent hot flashes are associated with a 2 to 3-fold increase in cardiovascular events, it is because of insulin resistant. As our reproductive hormones decline, we end up producing more. The hormones that increase as we age are insulin and cortisol. So we want to become more insulin sensitive. and that helps to reduce hot flashes. The other thing is hormonal management. Start with the adrenals with our adaptogens. For example, our Mighty Maca Plus formula really has helped so many people, especially who weren't able to be on hormones, stop their hot flashes. So the partially because the hormone detoxing ingredients and the antioxidants, as well as support for decreasing your body's inflammation and supporting your body's natural anti-inflammatory processes. So we see a decrease. So working with those adaptogens can really help with decreasing hot flashes, becoming more insulin sensitive, and then also adding hormonal support. So I start typically with progesterone and pregnenolone, and then I would add estrogen if as well if needed.
Mhm. Yeah, thank you
And
so much.
definitely in the perimenopause and postmenopause and postmenopause, making sure that our estrogen levels are sufficient is important because the balance between progesterone, estrogen, DHEA, and testosterone is something that your hormone provider should be looking at to keep you as healthy and optimal for the rest of our lives.
Absolutely. Test, don't guess. You want to know what your levels are. Very, very important. All right. So let's see here. I wanted to jump over to this question because it's kind of goes along with the inflammation. Why do I keep gaining weight around my midsection? Is a very important and common question
Yeah,
for
this is
menopause and post.
Yeah, this is a very good question because what women will say is, okay, I'm losing my waistline. I don't have my hourglass, or I'm gaining weight in my middle despite doing all the exercises, et cetera, that, used to work for me, for instance.
Hmm.
And so this is also a sign of inflammation, hormone imbalance again, but what's happening? So if we are becoming more insulin resistant, we tend to hold that weight, we tend to store it in our waistline more. So we'll have more fat in our waistline. Our fat is an organ. I don't want so much of it, but it is an organ and it does produce estrogen. So it can be a defensive mechanism to cope for low levels of estrogen. That may be one factor. Also, there are 13 metabolic hormones and that are driving our body's ability to utilize glucose for fuel and also for our metabolism. So we want to look at what's happening there, but also another key factor is cortisol. We tend to get mid stress. So as cortisol increases, we tend to gain weight in our waistline as well. And as
Hmm.
our hormones start to decline, FSH, which is a marker of ovarian function, follicle stimulating hormone, something I follow well post menopause, because a high level of FSH is associated with bone loss and brown fat conversion, so metabolically active brown fat conversion to metabolically inactive white fat. So we tend to get this increase in unhealthy fat. We can reverse that though, believe me, we see it.
Thank you, Dr. Anna. Yeah, that's always like the goal. That darn midsection is always can't contain so much like emotion too and fat, and you want to release it,
I,
release the weight.
I would add too, like think about our lifestyle. How much are we sitting? Are we
Mm.
on a standing treadmill or are we sitting a good portion of the day? I think the pandemic really created a lot of
Oh,
sedentary
absolutely.
health risks. And the other thing is, how much do we twist? For me, I love my boxing workouts because it's twisting. Nothing gives you a better waist than boxing, I'm telling you. So thinking of how we're doing functional exercises to support our back and our abdomen and our transverse abdominis muscles too, because that's our core set. That's our core set. So of course, we do want to really focus even more on that and also changing some of our lifestyle factors if we're very sedentary. I know that's been an issue for me. So,
Yeah, absolutely. I know this whole post-COVID working has been a lot where you have to stay at home, and now a lot of jobs are doing more hybrid work. Okay, so let's bring back to vaginal dryness. So, is vaginal dryness permanent? And what are my treatment options, founder of Julva? What do you recommend besides that as well? Like, what
So,
do you recommend?
so the reason I created Julva was to help patients, recover from vaginal dryness and bladder leaks and the thinning of our vulvovaginal area as we age. I say the most important anatomy of our body, clitoris to anus. I mean, we want to keep that area healthy because it will atrophy as we age if we're not doing something about it. And as much as we do pelvic exercises, we need to add back hormone to the pelvic floor area. And if we're not, I mean, we see on average 85% of women post menopause experience, at least at some point, symptoms of incontinence. And
Mm-hmm.
we don't want that. I'm a gynecologist. I know the tissue will age. And we don't want that to happen. I want to just give you a reality check here because if we look at our elder skin and we see how it can thin and easily bruise on the outside, right? I like our fine lines and or laugh lines and smile lines. I'm good with those, but like we know that we're losing collagen production, we're losing the thickness of our skin. And if you think
Mm-hmm.
of an elder person who has easily bruising, you can see all their veins, the skin's really thin, it tears easily. That's happening in the vagina, in the
Yeah.
vulvovaginal area, and that is not comfortable. Vaginal health is necessary for life
Mm-hmm.
and really part of optimal health, because if that um, isn't healthy, then we're going to have some issues.
Mm-hmm.
I used DHEA in my Jolva with the plant stem cells to help rebuild the collagen, to help rebuild the natural, to reverse the hands of time on this important tissue. And we'll see an improvement in clitoral sensitivity, improvement in the natural health of the vagina, but we also see the natural acidity of the vagina improve because as we age, it becomes more alkaline. I give a full module on this. Is something in my Magic Menopause program, is something I educate about passionately because I
Mm-hmm.
see way too many women still suffering, not being addressed. Estrogen helps, it works on the mucosal
Mm-hmm.
surface, but doesn't work on the deeper tissue. If we want to help the bladder, the urethra stay healthy and decrease incontinence and really have good sensation and pleasure, we want to add that DHEA, and we can also add testosterone vaginally if needed.
Yeah, absolutely. And for our listeners who aren't watching the video, Dr. Anna was referencing the back of her hand as a good indicator of being able to see whenever the back of your hand starts to thin or bruise easily. And that's also how we use moisture. We are moisturizing our face every day. Those are preventative methods. And same even at an event we were just at, some younger ladies were when we were telling them about Julva and how your vulva also ages along with us, and we want to use those preventative methods. And I even use Julva after my cycle because my hormones are like they need just a dose to just get back in a line. I'm like feeling so much better. And they were like, whoa, our vulva ages, like that wrinkles, that atrophies. What? I didn't know that. And it's very important to provide that knowledge to people because we're so focused on all these new skin treatments and being able to make sure our skin is elastic and healthy, that it's the same with our vulva. And what other options? I know Julva is top tier. What other options? Because I know there's a lot of procedures now for individuals. What do you recommend? Because I know a lot of spa treatments do in collaboration with Julva as opposed
Pre and post. So for
pre and
vaginal
post.
rejuvenation
Mm-hmm.
procedures, so certainly there are many ways that you can, the many different types of laser, light frequency, radio frequency procedures for vaginal rejuvenation. And, PRP, for instance, I just did a PRP G-spot injection. And so prior to having a procedure like that, I always recommend at least 2 months ahead of time to start using Jolva every day, and we can increase to twice a day a couple weeks before the procedure. I mean, you really see an incredible difference and improvement and beneficial results of the procedure. The other thing too is vaginal probiotics.
Mm-hmm.
And so we want the healthiest tissue possible prior to undergoing such a procedure, extensive, invasive,
Absolutely.
and expensive.
It is a procedure, exactly, expensive procedure. Just before you go into any other procedure, you want want to make sure you're taking your medicine, your body is in its healthiest position, or you're not drinking or eating anything. You're preparing before that. So like any part of your body, you're preparing and making sure it's most optimal self.
So true. And you want it to work and you want the results to last. So
Yeah.
post procedure as well. Yeah.
Exactly. Thank you, Dr. Anna. All right. So, what is the connection between menopause and bone health? That is a big conversation.
Menopause and bone health. So as we age,
All of these are big
they
conversations.
are.
Okay.
There's so many big topics, but bone health is critical for optimal health. And as we age, I had a client who's 37 years old and she was diagnosed with early menopause several years ago. So I did a bone density scan on her and she had severe osteoporosis. I had another young woman, beautiful Brazilian woman who at age 44 was in perimenopause and I wanted to look at her bone. She also was diagnosed with osteoporosis. So these are things that because of stress, post-pandemic stress, chronic everyday stress, just life stress, we really want to look at our bones, and the sooner we can look at our bones, the better. There are a couple things. A DEXA scan, you can now self-order a DEXA scan, pay for it cash, and you can often get it for under $100. That's a bone density scan. Many centers are doing something that also looks at the bone flexibility. It's called an ECHO-light scan, like echo, ECHO light scan. So there may be a facility in your area where you can get that. Again, it's self-pay. It's not terribly expensive, typically around $100 for these scans, and gives you a lot of information. And then for bone health, and I do also do a module on Magic about bone health optimization because there are several key factors, ways to look and measure bone loss between DEXA scans, supplements and nutrients and hormones that specifically can help, and how to tell in between if we're getting the results we want. And so important because as we age, what's the number one thing that causes women to have, um, to have significant morbidity? I mean, difficulty in life and challenges. It is that hip fracture. And then you're in a walker and then trip and fall, end up in a nursing home possibly, and your quality of life significantly decreases. The other thing, again, that bladder health is so important. So because often that hip fractures occurs while walking to the bathroom in the middle of the night and tripping and falling. So we want strong, healthy bones, strong, healthy bladder, strong, healthy quality of life.
Yeah, absolutely. And as there are certain workouts to do while you're on your cycle, there's certain workouts to do when you are menopausal, premenopausal, postmenopausal, as you have done programs with Deborah Atkinson, Natalie Jill, and Kevin, Dr. Kevin Ellis,
Mhm.
the bone coach. So there are many great programs out there too to help you. Um, so that's great. Great
There's always
knowledge.
one next right step. You'll hear me say
Yes.
that a lot. What's
Exactly.
my one next right step?
Exactly. And of course, there's a lot of articles that Dr. Anna provides on her website. Okay, so what are the pros and cons of HRT, hormone replacement therapy?
Okay, that's a couple hour discussion.
Okay,
Actually,
two, like, should we make another
all right.
episode
I mean,
synopsis?
I'm a big advocate of bioidentical hormone therapy. Again, I give a whole module on hormones and a separate module on testing and magic menopause. I'm a big advocate for bioidentical hormone started at an appropriate time and maintained. And so I do not prescribe synthetic hormones
Mm-hmm.
with, I would say, with rare exception for a certain reason and shortest duration of time. And that's been over a decade since I've needed to do that. So bioidentical hormones therapy, first we start with detox, our lifestyle, a keto-green method. We add in adaptogens, we add in detox support, nutrients, and make sure we're getting enough protein. All of those things, in addition to bioidentical hormones, are game changing for the quality of our life. So I'm a big advocate. The risks are if you currently have hormone detoxification issues, dysbiotic issues, we want to make sure we get that strained out. Risk the way hormones are given, depends on other risk factors, but the safest way is transdermal and transvaginal hormone therapy options, and progesterone. Oral progesterone has been shown to be perfectly safe.
Thank you, Dr. Anna. Now, how long do menopause symptoms typically last?
Well, that's again, sometimes I've had clients who've experienced menopause symptoms even 10 to 15 years post menopause. So we have to address the underlying metabolic issues there. But on average, I would say, yeah, I know it feels like 10 to 15 years, but you can reverse it completely. And let's make it the shortest amount of time. Let's say less than 12 months.
Okay, amazing.
And I would say with rare exception, there's that client. I mean, it is a rare exception where someone has their periods, they stop, they never have a hot flash, they don't have any weight gain, they don't have any symptoms, brain fog, hair loss. That is the very rare client.
Yeah. Also, I forgot to mention on our topic on bone health, Dr. Anna does have a discount code for DEXA scan. Use code Dr. Anna. If you are planning on using the DEXA scan, we will add the link into the show notes for you as well.
I didn't know I had a code for DEXA
Yeah,
scan.
you do, girl. I
You mean
got
body
you.
spec scan?
Is that not DEXA
No,
scan?
that's different. The body spec
Oh,
scan,
excuse me.
body spec also, I mean, does do a bone density scan, and that's
Oops.
like a $59 um, test. It also looks at body fat measurements and percentages. It's a really good scan to do.
I will double check myself. We need a fact checker over here for my own errors.
Yeah,
Okay.
body spec is available. They have some portable units. You really want to make sure they've calibrated it the day of your testing. And you want to just wear, like leggings, no zippers, no metal. And it's a full scan, DEXA scan. So it's a,
Yeah,
very low radiation exposure.
body spec also does DEXA
Right.
scan. Yeah.
The body spec scan is, yeah, but also does your body fat measurement. So
Yes, absolutely. I know. I need to go do one. There's one in Dallas. Okay. Moving on to heart health. How can I protect my heart health post menopause?
So healthy heart is key. I have my family, my mom's story. She had a cardiac bypass surgery when she was 52 years old. I was 16 at the time. And I realized that the research that much of her medical care was based on research done on men. And so that made me a women's health advocate. And I know I have strong cardiovascular risks in my genetics. But remember, genetics 25%, environment 75%, environment, lifestyle, nutrition, etc. So we can always tip the scales in our favor. So in heart health, it's important to have, like I said, huff, puff, and sweat, as a good friend, Dr. Edwin Lee, would say, huff, puff, and sweat. So you want to have good cardiovascular output, some type of high intensity interval training, where you're getting shorter breath, really work on that cardiovascular muscle processes, heart and lungs. And then sweating, infrared sauna is one of my favorite things for cardiovascular health, for sure. And nutrients, nitric oxide producing food, like in beets, beet greens, and beets, are the root of the beet is rich in nitric oxide producing nutrients. So that helps with that. So nitric oxide improves blood flow, improves vascularity. So looking at those healthy foods, and again, avoiding sugar completely. So much more to this topic. Those are
Yeah,
some key factors. And test, don't guess.
absolutely. Always test, don't guess. Guess.
Yeah, and
Sorry,
I
guess.
do. And in my Magic Menopause, in the module on testing, we talk about key cardiovascular factors, as well as there's a bonus module on cardiovascular health.
Yeah. Absolutely. If you have not tried Dr. Anna's Magic Menopause program, that is a must. But we are here for you to answer all these questions for you regardless. So, next one, back to sex. So, sex drive. Is it normal to have no sex drive after menopause?
While it may be normal, it is not optimal.
Yes,
So
ma'am.
okay, I have a whole course called sexual
We
CPR.
love
When
that
someone
course.
patient tell when a patient tells me, Dr. Anna, I don't have a sex drive, that's like a 7 hour discussion. So We can resuscitate our sex drive, and sexual health is necessary for optimal health. Sexual pleasure, intimacy, connection increases oxytocin. So there's
Hmm.
so many benefits to that. So while it may be normal, it's not optimal. And again, I work with clients all the time that get like a revival of their sex drive.
That Georgia slang coming out there for you. Okay. Yes, absolutely. And we love to hear those conversations in the group.
Well,
And
Mighty Maca helps too, and Jolva. And
mhm.
they always, this is an area I lecture and train physicians around the country on this topic of sexual health and intimacy because we want to support our adrenals. We want to support our connection. But I would say it comes to three things when we don't have a sex drive. The three main things in my now over 20 years of researching this topic, it's issues of desire, disconnect, and discomfort. If it hurts every time you do something, you're not going to want to. So there's a natural decrease in libido from that too.
Hmm. I know I love whenever we're at a trade show or something and we're sharing shots of Mighty Maca and guys will be like, "Oh, Maca, I got enough stamina or that makes me horny for hours." And I'm like, "Wow, amazing. Well, continue your Mighty Maca, sir. This has the other superfoods in there. So it's not just increasing your stamina, but it's helping detoxify and balance your hormones too." But all right, moving on to the next. We could go on this all day. Let's see here. What are natural alternatives to hormone therapy? Or are there natural alternatives to hormone therapy? I know you have your line, but also to listeners also just listening in for the first time, what would be some great natural alternatives?
Yeah. So first is to empower our body. Like I would say the first alternative is to empower our body to make our own hormones and use them even more efficiently. So that key, I mean, there's so many key factors. This is, it's a process. We know, for example, maca has been shown to naturally increase your adrenal hormone DHEA and decrease all symptoms of menopause, including hot flashes, mood swings, and improve sexual desire and function. So there's a lot of good research around these adaptogenic foods and how we can utilize them. And I would say it's the lifestyle, it's the adaptogens, the nutrients. I've created some great options like with my balance cream and my Jolva product and so much more. It's a complex piece, but also end with bioidentical hormones.
Absolutely. Thank you so much for breaking that down for us, Dr. Anna. Next, should I be concerned about my mental health during this transition? That's a powerful comment
Yeah,
question.
well, I think it goes back to even our discussion, the perimenopause section on
Mm-hmm.
the mood swings and um, yeah, anxiety disorders, mood disorders during perimenopause. So postmenopause, we're designed to be in our second spring of our life. The
Mm-hmm.
Japanese call it konenki. So it's the second spring of our lives. We're optimizing mental health and sharpness and compassion and kindness and joy and fun and sense of humor. It is our right to have that. So if we are not feeling at home in our body or our head, that we need additional support. So, working with a functional medicine provider, working with a good physician in this area is critical to make sure there's no other organic issues going on, what other complication, any other disease processes going on, and then help to restore our body's natural hormonal process. I think the hormonal changes can cause so many mental health swings. I mean, I can't tell you how many guys I've dated in their 50s. They say they divorced their ex because she was bipolar. I'm like, she was hormonal, not bipolar, most likely, right? Like, what is that diagnosis anyway? Anyway, we address the neurotransmitter imbalance there's multiple factors we can do. I think it is critical well menopause, if we are not feeling at home, to get additional help, to work certainly with
Mhm.
my methods that I teach in my Magic Menopause program and in my books and other online courses, because it gets to a core foundation of healing. And what do we need from there? From, you know, if we need other medicines or other hormones or whatever else we need for neurotransmitter support, we make sure we get it.
Yeah, absolutely. I know because even now, like there's more awareness going on, even through women's menstrual cycles to more awareness towards menopause, peri and post, and how there is such a change between you want to make sure that you're giving yourself enough nutrients and supplements during those changes. And I love like the videos that people are doing through peri and menopausal stages, as well as through like the follicular and the ovulation and the luteal phases. And that's there. And there's just so much
Awareness. It's so
awareness.
important to be aware. And then
Hmm.
say, like, these mental disorders aren't in our head, they're in our body.
Yeah.
To address the physiologic changes, then we need to
Hmm.
really be aggressive about that, because we want to be at peace
Hmm.
in our body and our mind.
Absolutely. And I know on our other episode that we did together, we were talking about how it was for your family when you were going through early menopause and then when you went through it again in a natural way, when you kind of had control over that. And you can just see the difference and the shift between the family then and where it was when you went through it again. And the same, we almost use like our cycles or menopause at the time to be like as an excuse for things. And I know even me coming down here today, I was like, I'm on my cycle. Like I just want to be curled up with my heating pad right now, but also taking my shots of mighty maca and just knowing that
You can be empowered. You don't have to
yes,
suffer.
exactly. And I'm just knowing the steps that I need to take to be there. So yeah, anyways, bringing it in both ways. Okay.
Yeah. Always, it's always okay. What's my body trying to tell me?
Mm-hmm.
Because I'm feeling this way. What's my body trying to tell me?
Yeah,
And to pay
absolutely.
attention to that. What, did I do yesterday that maybe didn't support my energy level today? What
Mm-hmm.
could I do? What can I do better today or tomorrow? And I love the book Anne of Green Gables. You guys, it's one of my favorite books. And in it, Anne says, I can't wait for tomorrow because it has no mistakes in it yet. And I love that quote.
That's a good one. I know. There will be mistakes, but not that I know of yet. All right. So next one. Since we're talking about supplements and for guiding through these stages for bone health, heart health, mental health, sexual health, what supplement should I consider taking?
So, always a multivitamin and minerals. Our food sources are deficient in so many minerals. So, electrolytes, minerals are key. In my keto-green shake, I put a complex of vitamins and minerals within that shake. So, it has albumin micronutrients and chelated minerals. What that means, really bioavailable in its activated form. So, that's why it's an essential daily, for for the most part on my life. I like try to get a shake a day at least. And it can be very simple. Like today's shake was just 2 scoops of keto green shake, some water, and I put in 2 scoops of mighty maca. It can be that simple sometimes. Adaptogenic support, I think, is critical for optimal aging and for hormone balance for men, women, children. I mean, I received a young 17-year-old who's been on Mighty Maca since 2018. Let's see, how
Mm-hmm.
old was she when she started? So
Oh,
2018,
they were like
7 years
in,
ago, 11 years. I mean, so she was
yeah.
11 years old, so 7 years ago. And she's a national wrestling champ. And she gave a Mighty Maca testimonial. I mean, on
So
her, I
good.
remember it was 7 years ago because it was on her Christmas wish list. I saw
Mm-hmm.
that picture. And
So funny.
so
Shout out to
adaptogenic
Ghana.
support is key. It's so important for empowering our body and detox. If we're not doing something to support detox, and that's why there are detoxifiers in Mighty Maca, we have to support detoxification because
Mm-hmm.
we are exposed to a toxic world as clean as we like to live and believe we lived in. It's so important. And I always say I like to choose my toxins anyway.
Mm-hmm.
So supporting detox. So healthy detoxifiers are critical. And omega-3 supplement, I think that is critical. For any woman that I've tested an omega-3 to 6 ratio, who have had more than two children or two pregnancies, who've had two pregnancies or more, they have all been deficient in omega-3s. You really have to look at your diet and supplement well with omega-3s through food and supplements. So those are some of the big ones. As we age, I like to use CoQ10 for cardiovascular health and support and energy. CoQ10 is a great supplement. I mean, again, I have a great supplement guide too on my website. So
Mm-hmm.
that can guide you through some of the most common ones that I use and recommend.
Yeah, absolutely. And then this kind of goes into our next question, how when you are taking your supplements and you're eating right, the next question is, how can I maintain my energy levels? So that kind of follows this, where you're detoxifying all those bad things. Oh, and funny comment before you answer. I just ordered a new perfume and immediately you go, Amira, that's like over 2,000 toxins that you're putting on your body. It's
200, yeah.
200. Okay, I know, but that's just for special occasions.
It's a hormone
Occasionally
disruptor, Amira. It's
I'll
a hormone
spray
disruptor.
toxins all over
Use
me.
essential oils.
I know I do use Bella Hadid's essential oil perfume and I love it, but for a special occasion I need a perfume that's a little more long lasting.
Mm.
I get that one. Okay, anyways, so what are some other ways that people can maintain their energy levels?
So, well, good energy starts with a good night's sleep.
Mm-hmm.
And a good morning starts with gratitude and positive attitude. So those are some of the key, ways to start to improve our energy. We may need to make sure we're getting deep restorative sleep and then support our energy throughout the day, movement, positive mindset, activity, exercise snacks, exercise breaks, oxytocin
Yeah.
breaks, oxyplay, of course, healthy nutrition, lifestyle, and remove inflammatory foods.
Mm-hmm. Absolutely. And I know definitely an increase in my inflammation on my cycles. I had a little bit of a brownie last night with my roommate, and then that did not help. Usually, when I eat right, coming up to my cycle, I don't feel any cramps. But then when I don't, I do it to myself.
I'm
Anyways,
gonna have to pay attention if my chocolate cravings, because I had dark chocolate nibs last night, and I'm like, oh, are my chocolate cravings related at all to your cycle?
yeah, I know that was like your thing growing up, chocolate and fries.
Yeah.
Okay, so Dr. Anna, our final question, through any new release studies or through your own research as well, any new health risk that people should be aware of for postmenopause?
Well, I definitely think
Okay.
brain health, neurologic health, bladder health. I mean, they're everything. We need to really cancer. We want to create bodies that are inhospitable to cancer. We've
Mm-hmm.
seen a rise in inflammatory
Absolutely.
conditions, diabetes, cancer, dementia. And these are things that, through healthy nutrition, lifestyle supplementation, a functional optimization, we can really reduce, if not eliminate, our risk. So this is really important. So I think so the toxic exposure is really key.
Mm-hmm.
So having healthy methods and frameworks to detox, get out in nature as much as possible, have healthy attitude. But what we're seeing in the medical clinic is, that I didn't see prior to COVID, let's say. We see more mental health illness issues, so neuroinflammatory issues that are confounding a client's health and well-being. We see autoimmune issues. We see hormone dysfunction, and those are critical to address. And for quality of life, we want healthy brain, healthy heart, healthy body for sure.
Mm-hmm. Yeah, absolutely. And kind of going to add a question to that for neuroinflammation. I know you've broken down a lot of the questions and what can help. Is there anything else related to neuroinflammation that you would recommend would that be the progesterone and pregnant alone to help? Like what would be some key to make sure your brain health is the
Definitely
most.
balance is key, but the whole keto, like the whole method, right? The whole keto-green method, but definitely progesterone and pregnenolone is key to brain health. And then, of course, nitric oxide, anti-inflammatories with, turmeric, we know
Yeah.
quercetin's critical, resveratrol has been shown. All three of those are in Mighty Maca Plus for a reason. And so those are great for brain fuel, but we always want to address the underlying conditions. For everyone, there's a key foundational aspect, and then there's fine tuning that we need to do to make those next right steps. So I would encourage everyone to really, if you haven't read my book, The Hormone Fix, that's like foundational reading because I go through many of these factors, and that can help you before, during, and well after menopause. But I'm also doing a 10-day Breeze Through Menopause Challenge. I'll be live for 5 of those 10 days to really help kickstart your journey. So that's coming up starting March 17th. And then launching Magic Menopause. So stay tuned for your emails. Make sure you're signed up at dranna.com to get that information and to join me live. And I look forward to it because I see transformations and transcendence, feeling at home in your body, feeling energized. I mean, if you can look on my, website or on even my Instagram page and see where I was at age 39. And if I had continued down that path, certainly I wouldn't be here today sharing what I am with you and helping others and in my private practice and online. So I would encourage you to join me. Stay tuned for my emails. Be sure you're signed up at dranna.com and send in your questions. I appreciate you guys. And I thank you so much for being here. This is Dr. Anna Cabeca. Till next time.
Thanks for watching another episode of the Girlfriend Doctor podcast. Check out all the links below for more.